So Joni, I mean, nobody wants to talk about COVID-19, but what do you see as the impacts of COVID-19 on behavioral health aside from just the social isolation?
Yeah, I mean, I think COVID was really challenging for a lot of reasons, and we all know that. We have seen, of course, an increase in need for mental health services as we're coming through this pandemic. What we saw locally and across North Dakota, Minnesota, was that a lot of our providers transitioned out of the field towards the middle or kind of end, year one, year two. As an employer, you know, I saw some providers really struggling in the beginning of the pandemic. They were experiencing this trauma at the same time as their clients. So they were feeling anxious and trying to figure out the homeschooling with their kids and all of these things and their personal life. And then they come in to work for 8 or 10 hours, and that's exactly what they're trying to give to their clients as well, is to help them, support them through that. And so it was really nonstop exposure without any point of relief or distance for a lot of people. And so I saw some burnout initially then. For some providers that did okay in the beginning, you know, once year two was coming around, they were, you know, kind of hitting their maximum point as well. And so we saw individuals, you know, providers asking to reduce down their time. You know, I want to go part-time. Or we saw providers say, you know, this pandemic has really shown me I need to be closer to my family. I'm going to leave and move back home closer to where my parents are. Or they had a loved one that was sick, and that caused them to need to step out of the workforce. We saw people really wanting full control over their schedules and over the clients that they were seeing and the payers that they were taking, and so they chose to go into private practice. We saw people take early retirements because of the burnout. And so we saw some of our providers stepping down, stepping away, stepping into different avenues, but then we also saw this increased need in our community, and we still are in a complete imbalance. And as it was talked about earlier by Dr. Wonderlich, getting through schooling to be able to serve and provide therapy is a long journey. And so we're in a space where wait times are probably much, much longer than we would want them to be because of some of the shortages and because of the demand that we've seen increase post-pandemic.